Jesscia Acolin from the Department of Health Systems and Population Health, and talking about public health perspectives on, and I will hand it over
It's
to
such a
you.
mouthful. When I looked at this title later on, I was like, wow, I put a lot in it. But yes, I'm Jesscia Acolin. I am a primary appointment in psychiatry and affiliate in health systems and population health. My background is in public health, health services, and before that in clinical mental health. Which will inform some of what I say, but really, since I graduated, I've been focusing more on climate change, which is why I'm here today. And so I will be talking about the public health perspectives on the social and economic impacts of climate change on health and well-being. At least some of it as an overview in about an hour and a half. So just breaking down the title, because I realized it was a mouthful, but actually it summarized everything I have on the agenda today. So public health perspectives, what does that mean? I'm curious in the room, how many of you are in the health sciences? Okay, cool. In public health or in like individual care, epi, global health? Okay. Okay, cool, cool. And then I believe everybody else, there was some engineers, some climate. So what I want to start with just is like, what is a public health perspective? What does that mean? And I was thinking about how to describe a public health perspective on the way over, because that is, in fact, what I am bringing. That is where the public health perspective comes. And the way that I could think about it is if you were like planning an outing, right? Planning to go see a movie. You had that one friend who like looked up all the movie times, figured out what was the best plan, right? That's like the researcher, the scientist, the epidemiologist. Then you have the friend who is ready to jump in when there's a crisis, right? Like somebody forgot something, they will jump in and solve it. That's, I don't know, emergency response medicine. Then you have the friend who is like, did you remember to bring tissues? You cried last time at the movie. Or, it's going to be really cold in the theater. Did you bring a jacket? That's public health, right? They're the ones who are thinking about the whole group and thinking about the good of the whole group and trying to prepare. Like the name of public health is really prevention. And that can be tough because when it works, you don't see that it happens. People don't realize that it worked. But when it doesn't work, it can be really bad because it affects everybody. And similar to that friend who might ask, like public health can be kind of annoying. Like, I don't need you to remind me again, but they're often right. So that's the perspective I'm bringing here. And I think that it really fits well with climate change because there's a lot about prevention in climate. And also there's a lot about how it affects everybody. And so we're thinking about the big picture, not just how each individual person is going to react. So then let's talk about the impacts of climate change on health and well-being. I think that you had another sort of public health discussion a couple of weeks ago. So I hope that this isn't too much repetition, but I feel like it still gives a nice background and we can just be reminded of it. I realized because I came into climate change from a public health perspective. And so I've been talking about this from the beginning. And I have to remind myself that there are people who've been talking about climate science for much longer, not necessarily about the health impacts. So we can go over this here. There are a lot of impacts of climate change on human health. And this is a graphic from the CDC that kind of goes over all of it. It can be a little overwhelming, but you can see it kind of runs the gamut, right? Heat-related illness, which kind of makes sense, injuries, fatalities, if you think about exposure to extreme weather events, asthma, cardiovascular disease. You all are very capable and you can read this yourself, so I'm not going to read it out loud to you. But one takeaway from this is just there's a lot of ways in which climate change affects human health. I like to think of it in a slightly different framework, which I think helps with thinking about how to communicate it. And that's by breaking the mechanisms down. Like how does climate change affect human health and how are some sort of big buckets that we can categorize that into? So one way to think about it is direct versus indirect impacts. If we start with the direct impacts, climate change to start with, are the geophysical changes in the world, right? That leads to then both acute weather events and chronic changes. and experiencing those weather events, experiencing those chronic changes. That's the direct impact. And that we know leads to things like injury, if you're experiencing in the middle of a hurricane, for example, traumatic stress, heat-related illness, respiratory illness, directly experiencing, for example, extreme weather leads to some medication interactions. The chronic changes is changing the layout of infectious disease, asthma, cardiovascular disease, mental illness. Does anybody have any questions on any of these outcomes that you'd want to dig into more? Or does that kind of make sense? Yeah. Yes. Yeah. So these are coming from directly experiencing that acute event or that chronic event. So like just being in a drought area, um, being in a hurricane, being in a heat wave. Yeah. Okay. Then there are the indirect effects. And we think of that as those that are mediated through some secondary economic and social effects. So what do we mean by that? You might have a change in arable land and agriculture as a result of drought, and which then can lead to food insecurity. So that's more indirect. You can have water shortages or energy supply chain shortages. Exposure to extreme weather can then lead to closures, school closures, shelter in place warnings. You can have job loss, retraining, and then increased disaster risk. And so it's helpful to think about this as indirect because when you're communicating this to somebody, being clear about how this is going to affect their lives, right? This indirect pathway hits a lot of people, a lot more people. Even if you're like, I was fine with this snowstorm, but you might be facing energy shortages. And those indirect, mediated through these social economic effects, can lead to other outcomes, notably mental illness. Forced migration and conflict is one of those secondary effects that then leads to these other stress-related outcomes, food insecurity, reduced healthcare access. Any questions on these? They kind of make sense. It's just like putting it in a list out there in one place. I want to talk a bit from the public health perspective, I think, on the mechanisms, like how we understand this climate environmental stressor getting under the skin to really lead to physical and mental health outcomes. The mental health outcomes sometimes are more intuitive. It's like, well, it stresses you out. That can lead to poor mental health, right? Sometimes the harder bit for people to get is why would that lead to cardiovascular disease? Like, why are rates of diabetes higher among those who have chronic stress? And so then we have to kind of dig into what we know about the relationship between stress and health. And stress, broadly defined, right, are challenges or things that somebody has to deal with that exceeds their regular capacity. Which is kind of that sort of broad definition to try and allow for, job loss, as well as divorce, as well as climate change. It's usually measured in a way of like your own self-report. Do you find that this was stressful, or looking at the outcomes? But first, there are clear biological ways in which the experience of stress can lead to health. And this is where it's like, it's not just in your head, right? Sometimes we get that when we talk about, oh, I'm stressed, just in your head, not really, because the stress response is also called the fight or flight response, and that is biological, right? You feel it. I'm sure all of us are aware of what it feels like. Your heart rate goes up, your pulse and your blood pressure shoot up. You have increased oxygen flow and stored energy is released. Basically, it is your body doing all the things to prepare you to respond to a threat. You need more energy. You need clear thinking. You need the adrenaline kind of gets you to notice the small details. That's really adaptive for that immediate threat. But if it is persistently activated, this is that chronic stress piece, where our bodies aren't designed to be on high alert all the time. So having that increased heart rate can lead to damaged blood vessels and arteries, leading to then higher cardiovascular risk. And that's one of those pathways of how our environment can get under the skin into causing sort of, I don't want to say like real, but concrete, observable, objective, physical health outcomes. Also, so one of the other ones is stored energy is released, right? Because your body is trying to use the energy to fight that threat, but means that they prepare for other threats you need to take in more energy. And so if there's a mismatch there, you end up maybe like eating more or your metabolic rate changes, which then can lead to weight gain, which then is linked to a whole host of other sort of suboptimal health outcomes. Does that make sense? And so this is one of the ways where you can say, like, if we go back to that indirect, oh, you lost your job. We can think about clearly that leads to economic, income loss, displacement, but also it can lead to long-term health outcomes that then also make it harder to maybe get back. All right, so biological. The other pathway is behavioral. And they're related, but we all know that when we're stressed, we try and do things that cope with that stress. And some of those things are good for us, and some of those things are not. So one of the ways in which stress then like gets into the body and can lead to these health outcomes is that the behaviors then lead to poor outcomes. So like if you're stress eating, for example, is a common example, right? Frequently, it's not the healthiest stuff, and it's maybe more calories than your body needs. That can lead to longer term outcomes. Substance use, which is one of the areas that I look at. We know that people, not everybody and not all the time, but one of the motives for using substances is coping. Use it to, feel better, use it to forget, use it to distract, use it to hang out with friends, and that can have its own set of outcomes that are concerning. Other behavioral ways might be like acting out, getting into fights. For kids in particular in school, getting into fights at school, having some social disruption, maybe not paying attention. And then when education has long-term effects on your income and well-being in the long term. Another way could be avoidance. Like you experienced a really bad wildfire and it scared you so much that you don't want to go out of the house, which can make sense for a short term, but then that means that you're cutting yourself off from social connection, which has impacts on your well-being. You are cutting yourself off from maybe, physical activity, as well as, just all the things that make up life. Okay. And then a third sort of behavioral way is crowding out. And this is where you're ruminating, maybe worried so much about this stressful event that you don't have time to think about something that might be good for you to think about. Spending all your time preparing for the next wildfire instead of applying for jobs. Because we all have limited amount of time, right? And so these behavioral modes of responding to stress also have downstream effects. And these can all play out when we're thinking about those indirect paths that climate change can affect health. Questions on that? Makes sense. Okay. And then we kind of have to give to nod to environmental. It's not really a mechanism, but it worked for the graphic where disparities in stress exposure and response account for a lot of the health disparities that we see in the world. And that's why stress has become such a key sort of explanatory mechanism in public health, where I pulled this quote straight from a paper. Differential exposure to stressful experiences is a primary way that gender, racial, ethnic, marital status, and social class inequalities in physical and mental health are produced. And that relates directly to climate change because we also know that places that are hardest hit or more vulnerable or have fewer resources to respond are already facing some of these vulnerabilities that are being exacerbated. So that was 16 minutes on climate change and health. And now you know everything you need to know, obviously. But I just want to open up for discussion. And so I think you can maybe turn to the person next to you or go into small groups and then chat a bit and then come out and share out. So the questions I have for you is how have you seen the climate change impacts on health communicated, if at all? I'm really curious about that. One of the common things that I hear in my field is I bring up climate change and the people in psychology are like, what does that have to do with us? I'm worried about it. I'm very worried about it. There's a snowstorm, but I don't really see how that relates. So I'm curious, actually, what all of your experiences are there. What might be important information that is missing from the conversation? And do you think that communicating health impacts will motivate action? And why or why not? So when we take like 5 minutes, turn to somebody and chat, and then you can share out.
Yes, this was I did. Yeah. And we're here, one of the children.
Here, but state wanted to get the here with the and I feel like working that is really that dating. So they're looking for the so I think they're yeah. But actually this is not but like yeah yeah like really and usually I feel that church. And what I'm saying. Every the beginning of that twice. They don't feel like they were like I think if you're in Washington, right? Like I think that they were talking about probably it used to provide but for generally it's not yet. But I think it's great. It's just they don't now we get the first one. It's us. Yeah. Yeah, that's me terrible. Like, that's it. Certain. But changes the airplane. Yeah, I think I'm gonna raise it up. Like what we do, that is, if I'm thinking about succeeded performance, is in a lot of things. Our solution that other or not. Yeah, but it's just it is to they don't and also like what is a that doesn't mean they not supposed to be in the short that are short in you know like well it's like it's correct you know it's great but I think that's from the same is bigger. Oh, it is. Yeah, this is kind of actually probably the time to be integrated. Yeah, but like they don't actually beneficial looking. So you're shaped faster. And that's like unless you actually because I didn't want to great.
Give a 30-second warning if you can wrap up your thought and designate someone to share out.
It just stopped me.
Yeah.
The business. Perspective is specialist section, you know. All right, I'm so excited and curious to hear what everyone was thinking. So just wrap it up and then does anybody want to volunteer to share first? Okay. Why don't you pick a number between 1 and 4?
3.
3. Yep.
So, I think that we are both in the health field. And so some things that stuck out to us, is talking about, responding to the first question of, how we see climate change impact on health communicated. Mostly we see it communicated as far as like in reaction to an event, a weather, an extreme weather or climate event occurring. And so it's more reactive and then like, this is how we prevent the impacts being so drastic in the future. However, the one like silver lining of that is that since being discussing climate change more or in health settings, it's reassuring to hear how many providers, how many people in the health field are focused on climate change as an issue and are seeing it as a link. Even if there are people who are like, I don't know how this ties in, they can see that it does tie in.
Interesting.
There are certainly still people that don't. It's like it is the least of their problems, but at least both of us in an academic institution, like we could see that there's a lot of concern about it, and that there's obvious crossover.
Mhm.
One last thing I was gonna add, yeah, absolutely, is that we also talked about what might be important information that is missing is like, even if there are like, say, an extreme weather event and there are a lot of people who come to the hospital for like heat stroke or like, I don't know, power outage because of too much snow and there's like issues with should be too cold. That there sometimes is no like explicit connection of like, this injury is related to climate change. As climate change progresses, this is going to become more common. And I just feel like maybe like care providers can take that extra step to like mention that. Because I imagine that if patients hear that connection more like casually, you know, just kind of being mentioned, there might be a greater awareness of like, oh, right, like these injuries caused by extreme weather events associated with change.
Yeah.
And they might get worse. Just kind of hearing that more.
Yeah. Yeah. I have a thought about that, but I'm gonna hold off until I hear from everybody. Anybody else want to know? Yeah.
We come from.
I'm MBA. You're an MBA. So I was like, that you were in like the College of the Environment, which is pretty expensive. And then we were both in the College of the Environment, and so we talked about that like in our college and like our various perspectives, we hadn't seen climate change impacts on health communication very much, and like even in this class when we had experts come from King County, they were mostly talking about like health communication and like communicating public health risks. That might result from a climate event, but not talking about like the climate change impact on that given health aspect. And we talked about like that it's like really basically just talked about like the intricacies of like how communicating climate change impacts on health is very difficult. And that like oftentimes there are extreme events that might have really like create a lot of issue salience for public health, like flooding or, you know, a hurricane, et cetera. But that like the actual like climate change tied to that event from a scientific perspective might take like a year to like actually analyze, and that like figuring out what the appropriate wording is to help folks understand elevated risk is really tricky. And I would argue that there's probably not enough communication between the like climate change science fields and public health as of right now. And I think that's changing, but it's something that's
I appreciate that. I'm still holding up my thoughts.
I think for our group for the first questions, I think it's pretty much the same. But maybe I personally want to add that maybe in Washington State it's quite good when we're talking about climate change impact on health. But back at home, I'm from Indonesia. I think we also not really this conversation is not really mainstream yet. But it's also partly biased because I'm from the west part of Indonesia. There is not endemic for malaria, but in the east part we have a big problem with malaria that is very sensitive toward climate change, right? So yeah, having said that, it is not really common yet, even in the other part of the world.
Mhm.
And here we also talk about how people may be aware that how the extreme weather events like flooding and excessive storm is impacting their health, but they haven't seen the link with the climate change.
Yeah.
So the link is not there yet.
Yeah.
I think we talked about wildfires in Washington a lot, and how I feel like there's pretty good messaging on how wildfire season's getting worse, that's making air quality worse, and that does affect public health when it's wildfire season. But I think having more communications around the health impacts of climate change events makes it more personal for people, and then also emphasizing like as future years come, this happen more often, like in relation to like their kids even. Like I think that can be motivating for action for people to see that link between climate change and public health.
Thanks.
I think I also want to personally add that in the policy realm, it's not, I haven't discussed it yet, but like in my perspective, in the policy realm, in the health system, it's also not really responsive to our climate change yet. Most of the narrative, as she said, that it's more on the in the community and the public facing, but in the policy making system, not all health system is responsive toward climate change yet, like how the policy should react of changing climate change. So
Yeah. Thank you. Last but not least.
It was also health communications for events, the direct impact. And perhaps there is a little bit more to health impacts, but less about the more holistic physical health impacts. I really like your point about, as an educator, I think it's both right skills that I don't know, you know, talk about individual versus.
I was just mentioning that there's a ton of research about the mental health impacts on K-12 children, and teachers, K-12 teachers seem to be the ideal people as trusted messengers, generally perceived that way by the public, to interact with kids around resilience strategies. And there are some really productive resilience strategies that are relatively easy to use. Teachers don't always feel comfortable using them, but they can help students cope more productively with mental stress. And also there's a lot of research on helping kids take collective action to like restore a local environment. seems to have a positive impact on mental resilience, as opposed to if the teacher emphasizes individual behaviors that can somehow mitigate climate change, that has almost no impact on their stress levels.
Yeah, that's actually, it's in the mental health side that I do most of my work in thinking about it. And that's one of the areas I think in asking this question. Like I've heard the argument a lot in my circles of almost like leveraging health communication because it's less polarizing. You know, nobody here talked about the polarizing current climate, no pun intended. But that, you know, if instead of talking about climate change, you could talk about health impacts, that might motivate people or feel less threatening or feel less polarizing. And I've always been curious about that because it feels a little bit like instrumentalizing something that does matter a lot. But talk of co-benefits and talking about, hey, climate change is happening and it's going to matter to you because of your health. So now will you do something about it, sort of thing. And that sometimes works, but I think what I'm hearing also that I've definitely seen is like if we go back here, right? Like there's a lot of communication on the acute events. And I think what I'm hearing is this tension between like the acute events matter, but they're not climate change. And I think in a broader perspective, and a lot of people I talk to, climate change is basically equivalent to like wildfires and heat events and these acute events. And again, what I'm hearing is this sort of complexity of how do we specifically say, hey, there's a long-term climate change aspect to it. And also something that I didn't hear very much about was talk about the chronic changes, right? Drought, food insecurity, displacement, like those would be this long term. And I don't think we hear about that as much. And one of those reasons I think is that it's a more complicated causal chain to explain to people, especially if we're not on board about climate change. How do you then explain the chain of events that can lead to it mattering? I think that's a good communication gap, because it comes down to this question that I see a lot is will it motivate action? And there is this kind of belief that talking about co-benefits or how your health is impacted, that brings it home to people and people care about health and health is a non-political issue for now. But thinking about how communicating this information in a way that really brings it home to people for their own impacts. I think there's work that can be done. All right, thank you. We're going to jump to the second part of this title, which is the economic impacts. And I'm really curious what a resident MBA will say about this. But so we've talked about basically how these causal mechanisms are linking climate change to health, but how do we communicate that? And one of the ways to communicate it is by putting it in dollar terms. So there are studies out there that are quantifying this that say things like medical costs related to heat wave related preterm births in China could exceed 300 million per year, and so on. I'm not going to read it all. And this is one of those communication strategies about health that maybe you're hoping to get the attention of a policymaker or the president of a health system, you know, to say, hey, look, the cost of this is going to be this much to you. So you should invest at least this much to prevent it. But I want to dig into a little bit how these numbers, how we come up with these numbers. And I not knowing everyone has such different backgrounds. So this is just a very sort of quick overview. If we take the preterm births as an example, what you start with is you have to calculate the heat wave related preterm births. And so notice it's heat wave first, right? And you can do that through epidemiological studies where you look at a heat wave event, see how many preterm births there were, compare it to something similar where there was not a heat event. And that difference is basically your estimate of the causal effect of that heat wave. So usually that comes out in like a ratio, right? It was like a 1.16. I think what they have in this one is they found a 1.19 times higher risk of preterm birth. And that can be from like existing studies, or if there's nothing existing, you go and run it yourself. So that's the first number that you need. And you can kind of see if that seems like a reliable number. The second one is then kind of what we were saying here. How do you distinguish the extreme weather event from the climate change? And this is more complicated than I really know, and probably some of you know better, but basically attributing how much of that attributable impact is to the human caused part, what would have happened if not for the human caused industrial gases, right? And so what they did in this paper is they mapped it out and said, you know, this is what would have these on this side is just how many they saw, right? How many preterm births. And then this is how much they're going to attribute to with or without climate change. And so you get a second number. You've now figured out how many roughly births you might link with the climate change part of the heat. Then it gets even trickier because the real question is like we can agree on these impacts, right? How do we put the dollar value on that? Let's see. What do I have next on here? Skip that. Estimating the dollar value. This is where a lot of judgment comes in, actually, right? Because you have to start putting dollar values onto quality of life, onto disease burden, onto all sorts of things. And there are various methods to do that. So one thing is that you go from preterm births, which is an event, to the health outcomes that are likely to affect the quality of life or somebody's functioning over time. And so by doing that, you kind of look for certain outcomes. So here they looked at neonatal mortality, and they looked at child asthma, diabetes, reduced IQ, and developmental disorders. These are all sort of well-documented outcomes related to preterm birth. Then you have to figure out exactly how much, compared to somebody who didn't have that, how much like worse, right? What is the cost of that disability for that person? And so you have these numbers called disability adjusted life years or quality adjusted life years, where you kind of estimate, somebody who's completely healthy, let's say they have a life year of 1. And then somebody who has asthma, because their quality of life is lower a little bit, you would give that a life year of like 0.95. Does that make sense? There's a lot of questions about how you get to those numbers, and there's various ways. Some ways are just you ask a panel of experts, how much do you think this affects someone's life? And then you assign a number between 0 and 1, right? Because one is a perfectly healthy life and 0 is death, basically. You have some ways where you can do a survey and say like, if you had this condition, how would you feel about your life or something? And you use that number to figure out what that disability adjusted number might be. You also have something called the value of a statistical life. Has any of you heard of that before? No. Can we pull that curtain down? There's like sun shining in your eye. Right. The other one, the one behind yeah. Thank you. Yeah. Oh no, you had your hand up, right? Thank you. Sort of. Yeah. I mean, it is basically trying to put a number on a life. And again, there are different ways of estimating it. A common way is to see how much you have to pay somebody, how much more to pay somebody to take a riskier job. So like, how much higher does your proposed salary have to be to work in construction versus like an office job? And from that, you can kind of figure out and imply how much that life is worth to that person. And basically the range of numbers there goes from like 1 million to 10 million. If any of you remember in like back in the Affordable Care Act debates, and they're talking about death panels, part of what they do in other countries is to find out if a treatment is cost effective. You have to calculate something like this, like, how much illness could that treatment prevent? What is the value of that? And so is it worth it to ourselves, our economy, the insurers to pay for it? They turn that into calling it death panels because now you're saying how much of life is worth. You have to put a number value on it. It was very controversial. That's what's happening here. And basically, you take this number, right? You plug in all the numbers, you find the sources, you try and make them as strong as you can, but they're making judgment calls along the way to then estimate that big dollar value of the cost of that heat wave on health outcomes. Questions on that? Does that make sense? This is like very high level. You can have an entire class on this, but I think it's useful to know what's behind that number. right? Both in communicating it and also why, like, how do we get to it and what does it really mean? Okay. I kind of want to do this one just like shouting it out. Like what do you think? What are the pros and cons of the economic method of presenting health impacts? Yeah.
I mean,
Hmm. Explicitly, at least. Yeah.
still on values. So if they're like trying to do policy wise or report, you're like, hey, this climate impact costs this much money. It's a way to get companies to pay for repercussions.
Yeah.
So more of a tool, not the best paper.
Yeah.
Person to person.
I agree. And I think this is an interesting contrast to the conversation we were having before about how health impacts are communicated. Like those are directed towards individuals, whereas this sort of communication is directed towards decision makers. But like if you're a decision maker and someone said like this is going to cost $100 billion, what would you do?
So I think that value of this is that a lot of the changes that need to be made in order to like cut emissions, like mitigate and make the adaptations that we need in order to help us not be quite so in the rut that we're in, is that they cost money. And so this can help us say like, okay, sure, it's gonna cost this much money now. But the long-term effects of this much money down now is that we're gonna save this much money times this many people getting this kind of sick over the next however many years. And so, I mean, you do have to kind of speak economics to people who only think in economics sometimes. Because talking about the health impacts that are mostly going to start impacting people who don't have the ability to get on a plane and move somewhere where it's not going to feel really hot, really wet, really unable to find food,
Mhm.
doesn't sell. Like
Yeah.
the people who have money are always going to be able to find somewhere more comfortable to live
Mhm.
and pay for a way out of climate change. But not everybody else can. So if you can say, okay, well, it's going to cost you a lot of money to continue to
Yep.
live the lifestyle you're living,
Yep.
it's going to impact everybody else too.
Exactly. Yeah. And I think that's one of the hopes of the economic sort of communication. And like if you are a business leader and you're thinking, well, I don't want to spend this much money to adapt, like that's then one way a lot of times the comparison that somebody's making is like things will keep going the way they are. Why should I spend the money versus making you spend the money? And you're saying, no, the comparison actually is you will lose all this money later or can spend it now. And so like making that a clearer comparison means that what you're making a choices between are better. I think a con can be, and I didn't actually say this here, but you have to decide what your problem is, right? And climate change is so complicated that do you focus on preterm births only or preterm births and heat related illness? Like who is your audience? Are you talking about the cost to the people who are sick? You can also do it from the perspective of the health system. Like this is going to cost the hospitals this much more because you'll have this many more people coming in. You could talk from it from the perspective of the insurers, being like, you have to pay for this care. And then there's so much uncertainty, right? You can do this over the course of 10 years. You can do it over the course of 1 year. Like, what's the decision frame that people have? And then, like, you don't want to overstate your case. right? It's because I mean, part of what I wanted to point out with these steps is that along every step of the way, there's some judgment calls being made of what you're counting, of what the outcomes are, of what's relevant, of over what time period, of what you think is going to happen. And even in your best estimate, we are making assumptions. And you don't know if like you estimated that 1.19 higher times likelihood, but actually next year, half those people left. And so actually the cost you end up with is not what you expected. And and that's something I think to think about when, especially because something about numbers like that make people feel like they're very certain. When I can give a dollar amount, this must be true. You really did the math and I believe it. And that can kind of overshoot. Where we know that a big question is uncertainty when we're talking about climate change and how do we best prepare for it? And then also knowing that it's behavioral, that people will respond to whatever policies put in. It's hard. But I do agree, and I think these are the main points with economic communication of costs is one, motivating actors, and two, deciding how much to pay for something that you're doing. And the interesting part here is how we're putting a dollar value on something as intangible as quality of life, illness, or health. All right. 51. The social impacts of climate change on health and well-being. Why do I have this on here? Are you all familiar with this? The billion-dollar disasters? No? So this was done by, I forget, Noah, right? This is economic costs. So this isn't health costs at all, right? This is property damage. This is property loss due to disasters. And they have this project currently on hold, I believe, of documenting how many billion-dollar disasters hit the US in these years. And this is kind of like doing what we were doing with the health part, but this is focused more on property economic damage. So that's why I have this on here, because this is dollar amounts being put to the purely social part, this not health part. And I'm sure that this is not news to anybody here, but we are seeing this number going up, and it's because of increased exposure, right? Whereas as the population grows wealthier, you have more to lose. And so the amount that we're losing in each of these disasters is actually going up because of that. There's a vulnerability. This is the extremity of the disasters, but also that a lot of development is happening in high-risk areas, even though it shouldn't really be doing that as much, and then the frequency. So that, I'm sure, is not a surprise to any of you. But part of what my goal I'm talking about today is like, how do we connect the dots, right? From the climate change thing, this big abstract thing that is overwhelming for people to think about, to like, how is it having an impact on our lives and through health? And so here's a case study of home insurance. And again, I don't know how familiar you guys are with this. But basically, so home insurance is required for buying a home. Basically, in order to get a loan, a mortgage, the bank would want to make sure that if anything happens to the home, they will get their money back. So it's roughly required. But these insurers are starting to realize that as disasters go up, they're needing to pay out more. And so it's getting more and more expensive. And so you can see in this graph that the home insurance costs are soaring, and most of all in the places where climate hazards are the highest. What this is actually leading to is that in some places, insurers are stopping. They don't want to insure anymore, right? And so this goes from not giving the loan in the first place for a new homeowner to people who are having their homes canceled, right? The home insurance canceled. They have a mortgage, they have like 15 years left on it. And they cancel, if the home insurance is canceled, they need to get a different mortgage, and they can't because right now they're in a high-risk area. Let's connect more dots, right? So here we have climate disaster risk. Now we have home insurance risk, right? How does that then lead to other social outcomes? This is like a very quick thing, but we know that there's social benefits of homeownership. And this kind of goes to the well-being part of health and well-being. We can debate if it's homeownership or housing stability, but knowing that you have a place that is stable for you to stay, right? It helps with child educational achievement. It helps with civic participation. Crime levels are lower. People maintain their properties. There's social cohesion, which we know is really important for building community and collective action. So as if we're connecting the dots, home insurance canceled, might need a leave, breaking and losing some of these social outcomes. In addition to what we know are some of the health benefits of homeownership, which again goes back to the same causal model of stress or lack of stress and how it relates to various outcomes. Um, so, so this is one way in which we can think about climate change leading to social impacts and the health, social impacts, and then also health outcomes that are tied to those social impacts. Does that make sense? Just a case study. There's another pathway. I said indirect and direct ways that climate change impacts health. There's a third, which I call it vicarious. We call it vicarious, which is even for those who have not experienced either the extreme weather event, the drought, or the social economic impacts, we're aware of it. And this is where a lot of the K to 12 students come into play, growing awareness. It's on media, it's on social media, and a lot of the headlines look like this, right? They're very catastrophic. They're very scary. Being exposed to this, being aware and growing awareness of climate change is actually linked to, in itself, stress and poor mental health. You might have heard the term eco-anxiety, climate distress. It's a social concern because it's so widespread, right? Like we do have numbers that the vast majority of young people are worried about climate change. This is across red and blue states. And we also, let's see, here's more numbers. A lot of young people are feeling this way. And this is focused on young people because that's kind of my area. We also think about how youth are at higher risk, first developmentally, because they are facing these stressors at a younger age. And that can be shaping how they make decisions, but also the youth will be living through the future for longer. And so the impacts of climate change are hitting them, going to hit them worse. And so in terms of a social impact, when we think about disaster response, when we think about acute weather events, we can focus on those that we know are going to be affected. But we often don't get to think about those who are not in the line of fire, but are reading about the LA fires in the headlines and worried about their own safety. Or kids who are learning about this in school and then wondering if it's safe for them to go outside. Or I did some focus groups with young adults who said things like, you know, there's no playbook. There's no one you can ask about what to do with climate change because it's not something anyone else has lived through. And so that makes it just so much scarier and you're lost. There is powerlessness for youth in particular, where kind of talking about the individual versus collective action piece. They're not the decision makers. And what does that do? Especially when we're in a climate, right, which can add stress in so many other ways. I am assuming, depending on the audience, I spoke to a class last week where only 2 people knew what the engagement finding was. And it's like wild to me, right? I mean, it really highlights the side of sort of silos and things that I was like, wow, this is the entire big news. And it was like halfway down the page of the New York Times. So you all know what this is. And youth, and I mean, people in general, right, who are already worried about climate and also see this kind of news, as maybe we all have lived experience, can increase your distress and stress. Did I? No. Okay. At one point, I had in this slide here that this is a socially mediated pathway, right? It's not through direct experience, it's through social representation that changes risk perception. I thought I put down here, there's climate anxiety distress, and there can also be climate denial. Like we know that avoidance is a way of dealing with stress. Finding what's familiar, finding what's stable, finding what you know. And as that stress goes on, if we talk about ways of coping and maladaptive and adaptive coping, denial might be one of those ways, right? Avoidance is one of those ways. Feeling where you feel safe is one of those ways. And what are the impacts of that on our social landscape? We don't have numbers on that, but I have my own hypotheses. At the same time, like we know more and more people are experiencing this. Like there's awareness. And have you all seen the Yellow 6 Americas? So this is the survey of different responses, right? And so this is bringing this up to different audiences. Like most people are worried. And that, in terms of climate distress and climate anxiety, is really helpful for people to know. Because there's a sense where the information that you get out there, it can feel like you're the only one who feels that way. And there's not spaces to talk about it. And that then ties into the polarization, the isolation, the lack of social support that is out there. And sometimes people like, I showed this to a class yesterday, and they're like, "Well, where's the seventh group that's malicious?" And I was like, you know what? I think they're in every single one of these boxes. You know, the malicious group does get a lot of attention, right? What's you know that the media environment, especially right now, is designed to hold our attention. We're an attention economy. And so that's one of the mechanisms by which this social representation here, which is not to say that climate change isn't worrying, right? But the social representation of climate change is another side effect of the fact that it's happening that then leads to these other health outcomes. All right. This is the same thing. This is the same thing. The other interesting thing, though, about how we would want to talk about this vicarious route, this climate distress or climate anxiety, and I think you touched on this, is that while we know this is some like early findings from my own work, that climate distress is linked to maladaptive substance use, like more days of alcohol use among young adults, it's linked in almost the exact same magnitude to taking environmental actions. And so this we talk about like distress is not necessarily bad. I mean, when we talk about climate anxiety and the traditional sort of public health response is like, oh, let's treat that. Let's bring your anxiety down. Let's like see if your symptoms reduce. And in this case, that's actually maybe not the goal because it is adaptive. You know, there's very good reasons to feel distress and anxiety. In fact, you know, some people could say if you're not paying attention, right? It is a valid and adaptive response. And we know that with healthy levels, that fight or flight response, that anxiety motivates action. Like when you're really stressed, you will study harder for that test sometimes. And so talking about the mental health sort of vicarious impacts of climate change requires kind of a shift in how we talk about treating it. Like the goal is not to reduce it, it's maybe to tolerate it and to find ways to channel that energy into those positive behaviors. And this is one of those areas which I think that's a co-benefit that I think about, right? Especially because there's such a broad audience that's feeling this distress, that is feeling lost about it. But like we know that is sort of like potential energy harnessed, that they care. And so the social parts don't have to be all bad, if that makes sense. Okay, 304. Let's do another like small group thing. 5 minutes. What do you think would be important in a communication strategy, keeping in mind kind of what we've talked about so far? Is that too broad or is that? Okay. Go with it. And if you have questions, like raise your hand. I think it's good. It's finished. Yeah, the last bit is just it's good. Back up, please. I was not. Yeah, things that there. I mean, it's something that, like, I can hear Paul, like, right, that's what I'm initially just say to, yes, I do that. And. Yeah. Involved in the, and the other. Just. Yeah. Because of that. Yeah. Wow. People. Yeah. Yeah. I'm sure. But yeah. Yeah, that the process that they form, but not the absence of inspires. I feel like as an instant. Yep, this means the president. Yeah, the different levels. Say slips. The goal of not invalidate. Right. I think that's what this is. Yes. Yes. Yeah. That actually, so that's what we're, because. Like, what are the, I'm gonna try and get into this. Like this just solving. Yeah. Easy enough. That's what. Just be able to. Yeah, yeah. Have you, yeah, bring it. Okay, let me. Yeah. Mm.
Yeah.
I think I will pivot. I won't do this part, and we can talk about managing anxiety and distress. Yeah. We'll see. I mean, maybe you'll do it. It's helpful. Yeah. Yeah. I have 43 seconds left. I have to close the curtain. But that's something that you do. Oh, okay. That's time. If you can finish up your thought. Then I mean, let's do the same thing as last time. Anybody have a volunteer say? If not. All right. Why don't you pick a number between 1 to 4? 1. 1.
do like some, this was we found COVID presentation for communication strategies. Which were that, like, we felt like, the fact that you can communicate, to people and it will lead to potentially taking like the pro-environmental behavior, like kind of even your last slide, was like we felt like a win because we've had some speakers in class thus far that have had the perspective that like communicating climate risk can like lead people to just like bury their heads in the sand. And so like that was a positive finding, and we kind of talked about like just like the hope of like if you're communicating well and communicating the science correctly and communicating the public health risk, like that you could help have people both create personal adaptations that keep them safer and improve public health, but then also lead to mitigating action that benefits people. So that was a very general answer to a very general question. I acknowledge that.
It was a very general question. I acknowledge that. I was kind of curious what would come up. I'm glad it gave hope. I'm going to talk a little bit more about that in a second.
We talked about how it's a good idea to potentially evaluate where your audience is with their understanding of and acceptance of climate science, to kind of tailor your message towards that so that you're not like throwing all of the like red warning scary at people who are already experiencing climate anxiety, because they're acknowledging what's happening, but maybe bringing a little bit of like and some kind of messages of hope of like these are strategies that are like happening and taking place around the world, and like they're like kind of being a little inspirational there. And then conversely, like with people who aren't quite on board yet, trying to swing and find something that is meaningful and they can grasp onto and that will hopefully help buy in a little more. So understanding what will kind of sell to your audience. In the messaging.
Yeah. So I'm hearing both including hope and action and also tailoring your message. Either of you want to do?
About like thinking about your audience and what messenger would be the most effective at delivering your message. Like if possible to get like an Olympic athlete or Billie Eilish to like do a video for you that's get more attention than like climate scientist or like public health expert might. Like people are gonna stay and engage with that content longer. But we also thought about trying to tailor like the action items to the audiences and communities that you're targeting, like advertising like local events to like clean up the park or like remove invasive species or like work on like a food security like projects for the community, like that sort of connecting back to like for K-12 students, how having like a collective action can be more healing than just like trying to be like an individual and like fill out this petition and call your representative.
So I'm hearing also choosing your messenger wisely, tailored to your audience, knowing your audience, and also presenting specific actionable things that are relevant to them. Yeah, I was just listening to the headlines, I think, where like after Bad Bunny's Super Bowl performance, salsa class participation has gone way up. Like, you know, if you had somebody out there, like, I don't know which action it would be. You don't have to say it, right? It's not like he was like, go to salsa class. It's very cool. Right. Anything you guys want to add?
What stress level are you trying to get at?
Yeah.
Are you trying to get the words?
What stressful level do you want to get So I want to stay on that for a little bit, because I would wonder if several of us in this room experience climate anxiety or climate distress sometimes, and it can feel pretty overwhelming. And that's what's I think the tailoring part matters, right? Because what motivates people, that's kind of maybe another takeaway. What motivates people to act is going to be different. If I go here, there's nope, this here. The stages of change model. How many of you are familiar with this or have seen this? Okay, so this comes from behavioral science. It actually really came out of substance use and addiction prevention, but it's all about how you motivate people to take behavior. And what they found is that generally we know, and they proved that information is not what motivates people to take behavior necessarily. That there are various motivations that you have, and that's kind of the first part we we're talking about. But then there's also how ready a person is for change. And being able to tailor your message to where in that cycle somebody is. Like it's a surefire way of having no response is to get someone who's in pre-contemplation, where you're not ready to do anything, and think that they're in action, which means they're ready to take on something. Pre-contemplation people are like ambivalent, right? Or they're like, no, they don't even see the problem. And so the step with them is to move them from pre-contemplation to contemplation. Like, oh, this is a problem. Without sending them down to completely blocking it out. And that's a little bit like when we're talking about that level of stress. Like, what's the level of stress that's useful to get somebody to think it's important enough to be a problem without it being overwhelming? And that's where some of the, like, I think individual health impacts, we don't need to say climate change. I have another part here that somewhere. Oh, agreement is less important than action, right? Like if there's a specific action, you can bring it home to them. They might not need to know that's about climate change. If you're able to move them from like, it's not a problem to it's kind of a problem. Then from contemplation to determination is like, oh, it's a problem, but I'm kind of ambivalent. I'm not sure I'm gonna do something about it to like, I think I do want to do something about it. Like that's another step. And that usually then is more like self-efficacy. Like I think we're talking about hope. Like there's a point in me acting. There's a way to do it. There's something I could do. And then that's somebody who's kind of thinking about it to be like self-efficacy. It's possible. You have it in you. You have your resources. From there to action is like, okay, I'm ready to do it. This is where we think a lot of people are, but they're not. I'm ready to do it. All I need to do is like set my alarm and get up in the morning. And then you all know that we don't always do that, right? So what are the strategies to get someone to be like, I'm ready to actually act? Like this is like the problem of like New Year's resolutions. I'm ready to do it. And then it's hard to follow through. And so strategies of like decreasing barriers, nudges, making it as easy as possible. Like don't go to an event on the other side of town, like bring it here. Or I think that's where a lot of signing petitions, it's like, oh, I'm ready to do something. It's easy. It's not always, doesn't always feel good, but it's easy, right? Reducing that barrier to action. You don't need to, get an electric car, just take the bus once. And those reducing the barriers to action to somebody who's ready in that spot needs to have a reinforcing cycle to say, hey, I was ready. It's a problem. I can do it. I did do it. Great. It's a cycle, right? And so, I mean, this came out in substance use. And so you have action, like they're like, I want to quit. And then there's relapse. And in this case, it could be like, I really wanted to do it. I took the bus, but man, I cannot today. And now I feel like I failed. And we know that we can't do that either. Like every little bit counts. And I think something that's hard in climate change and that can really lead to this distress and anxiety in people is that it's this gigantic problem and we're all this big and none of us is going to solve it, right? None of us is going to solve it on our own. Like by definition, it's a collective thing. And so seeing it, the relapse maintenance as part of the cycle, and people come in and out at all times, and they might be one place for clean energy and another place for taking transit and another place for something else. But when we talk about tailoring, like the Six Americas, I'm really curious if that maps onto this a little bit, right? And if that, then you can start tailoring messages using the principles of behavioral science, knowing that also information is helpful, but it's not necessarily what motivates behavior. And understanding what's the thing that people care about. Is it their individual health? Is it the fact that their kids are stressed out? Is it the fact that their energy bill is going up? Like, what's the motivation here that can bring them to that next step? And finding that, like, drawing that causal pathway to how this small thing you're doing might be part of the bigger picture. Oh, it's 2:20. I just want to do a quick note. Climate anxiety, I didn't mean to say that anxiety is good and that if you are like, there's a difference between healthy anxiety, that means that you are still able to act, and sort of worrying anxiety or difficult to live with anxiety where it's paralyzing. And the goal generally is to keep it within the healthy anxiety range. And there are various skills, like you can look them up. Just it's called distress tolerance skills, where you do things to live with it. Also, another useful framework, if you're not familiar, is trauma stewardship, which is a set of practices thinking about when you're dealing with a problem that's too big. So I'm going to throw those out there as resources. Thank you all. I really enjoyed this.
Thank you.